Hi, it's James Cunningham here from Toronto Wolfpack.
And thanks for coming on treated.com. I understand that you've had coronavirus. I just wanted to ask you a few questions about that. So, how did you find out?
Um, so I went into training one day and I was feeling a little bit under the weather. It, it was like the symptoms went very severe at first. It was just like a little bit of mild fever, a bit of a tickle on the throat. So the physios down at Toronto have told me to go home and just self isolate and get in touch with the club doctor. So I didn't actually get tested for it, but during the self isolation, like the first 2 or 3 days, my symptoms just got a lot worse. I was exhausted, fever got really bad, and then I just got like a really aggressive cough afterwards as well.
Okay, and how did it affect you and the people around you?
I live alone, luckily, so like I didn't have anyone that I could pass it on to. It's been hard work, living alone for the past 2 weeks, not leaving the house. But luckily, I had some friends to drop things off, and I was quite vigilant in the way like that I didn't leave the house, and I made sure that I
Yeah.
didn't pass it on to anyone else.
And have you fully recovered, or do you still feel some symptoms?
So to be honest, now like I've just got like a really bad chesty cough. I'm coughing up a lot of phlegm off of my
Right.
chest. Sometimes when I'm breathing, like I can hear all the mucus vibrating like on my
Yeah.
chest. But other than that, the fever's gone, and all the other like aches and pains, they've all gone as well. It's just the cough now.
Right. So, when do you think you'll get back to training?
Um, but I wasn't lucky in the sense that I had surgery, but I had surgery on my hamstring, so I've not been able to do any conditioning or running or anything anyway.
Right. Okay.
So it's given me a little bit of extra time to recover and rest up. But like at the minute, I don't feel like I could return to training. Just through how my chest feels,
Yeah.
just like walking up the stairs, I'm getting really short of breath, and just having like coughing fits every now and then as well.
Right. And how does it feel, kind of knowing you've had it, and seeing all the stuff on the news, um, knowing that you've been through that?
Yeah, well, for me personally, like I can't stress enough to everyone how important it is to stay indoors, and just not spread the virus because, like, I'm an athlete and I was really struggling.
Yeah.
I'm supposed to be like a fit guy, and I was really struggling. Couldn't get out of bed, like, and I feel like vulnerable people would really struggle with this virus. For someone who's supposed to be of good health and fit
Yeah.
and healthy, for it to affect me so much, I can't reiterate enough how important it is to stay at home and follow the government's advice.
Yeah, I think you're right, and that's certainly my experience as a doctor. Even kind of fit, healthy young people are getting quite ill with it. I mean, yeah, there are some people that have quite mild symptoms, but there's people like you who are fit and well, who really get kind of knocked for six. So, how long have you got kind of left to stay inside? I know we're all under lockdown, but what advice are you?
Yeah, so to be fair, like I was inside for the 14 days, but I still sort of had some symptoms. I was still a little bit feverish.
Right.
So I got in touch with the physios and the doctor at Toronto, and I just made the decision myself that I was going to stay indoors for another few days just to make sure.
Yeah.
And then sort of like when my symptoms subsided and got a little bit better, like I've been out for a couple of walks and stuff now, but obviously I'm still trying to avoid people, and I'm really anxious about if
Yeah.
I've still got it. I don't want to pass it on, so like I'm not going near anyone. Like I'm walking safe distances away from people. Like I'm just trying to do everything I can. But obviously, it was nice to get out of the house and get a bit of fresh air because it's been pretty hard stuck indoors.
Yeah, I think people haven't realised how hard it is, have they? When you're stuck inside, it can really kind of get to you. Is there anything else you wanted to kind of ask whilst you're on the phone?
Yeah. Oh, to be honest, like it's just now I didn't know like if I have been left with like bad lungs or like a chest infection because I am actually really struggling now with my chest, and I have got an infection on my chest because I'm constantly coughing up phlegm and like all sorts of mucus and all that. Like do I need antibiotics, or like how would I like go for getting better? Do I just drink loads of fluids, or?
Yeah, you're right. You do need to drink a lot of fluids. I'm doing some work with NHS 111, looking at kind of helping people with symptoms. And what we're finding is that lots of people are getting better, and they're kind of feeling better in themselves, but the cough carries on for kind of 2 or 3 weeks after the main infection. So
yeah,
carry on coughing is not. I'm not that surprised.
yeah,
You do need to be a bit careful, though. There's also quite a few people who, in the second week, seem to get a secondary infection. When your chest is kind of vulnerable and kind of down, you're vulnerable to another infection on top of it, like a bacterial one. So there are a few people who we've been treating with antibiotics when they've kind of recovered a bit and then gone downhill again. So if you feel like your fever's come back, if you get breathless at all, like you will get a bit breathless trying to go up the stairs, but if you're more breathless than you think you should be, certainly if you're breathless at rest, then you probably need to ring 111 or your local GP just to let them know what's been happening. And it may be that some antibiotics might be the right thing to do. Or the team doctor might be able to kind of tell you something as well. You don't look as if you're particularly unwell at the moment. And my feeling would be...
Oh, thank you. Appreciate that.
Probably, the fact that you're talking in full sentences, you can have a laugh, you're not kind of struggling. Antibiotics are probably, I wouldn't rush into them. You're not out of the woods yet. And over the next few days, if things are getting worse, or certainly if your fever comes back, then it's probably worth thinking about. Yeah.
Cool. And there was another thing as well, which was quite worrying. Well, it's not obviously one of the main effects of it, but like I've completely lost smell and taste. So like I can't smell anything at the minute, which is like pretty bad because I can't smell my own armpits, so I need to like shower more. But I can't taste anything either, and it's been like this now for over 2 weeks. No smell and taste, and it's not coming back at all. And I know like a couple of people have messaged me on Twitter and have been worrying about it and wondering if it will come back. And I didn't know if like it was something that you knew about.
I suppose the honest answer is we don't really know because it's new. The people that I've kind of consulted who've had it seem to be saying it comes back, but it takes a while. So if it's 2 or 3 weeks, I'm not kind of worried particularly. But if it got into kind of 6 weeks and you still hadn't got anything back, then that's not such a good sign. But as things recover, your body's very good at kind of fixing itself, and it will probably come back.
Yeah, I can just imagine that. Obviously, because with me, I had a huge loss of appetite as well. So like I was hardly eating. I lost quite a lot of weight through not eating. So obviously it'd be important to remind yourself to eat, because obviously we're in a weakened state anyway through the virus. So you don't want to be not eating as well to make yourself feeling like a lot worse.
And even if you feel like eating, you need to eat some things like to help your body recover. But obviously, like sensible, healthy food would be better. But whatever. As long as you're not eating nothing. It's really important, the fluids, making sure you're drinking, like water's best, but as long as you're drinking something that isn't alcohol, then that would be good.
Cool.
Okay.
All right, thank you very much.
Well, lovely speaking to you, and get back again if things get worse or if you've got any more questions.
Thank you very much, mate. Cheers.
Cheers, take care.